Welcome back to Focus on Health. We have been talking about cervical cancer, which is the fourth most common cancer among women, affecting around 570,000 people worldwide. But first, we are going to go to the streets to hear what people have to say about this in relation to poverty and also the survival rate.
The cancer of the cervix, and I think it's a woman thing. It's women related, and well, it affects mostly people from low grounds and poverty, because, well, people can't afford to have medical attention, because cancer, well, it's a bit expensive to treat cancer, and it's a very huge disease. When you hear about cancer, you're like afraid about cancer. Yeah. And so it depends on how well you get the treatment, but mostly if you can't afford, it might be a death sentence. Yeah, that's my thinking.
Well, I don't know what cervical cancer is, and as you said, maybe poverty is the cause of cervical cancer. I can't say really that it's that. Maybe what I think it's cervical cancer is caused by what we eat, what most people eat. Maybe most people are used to eating of this much fats. Yeah, and these drinks, maybe they can be the cause of that, but I don't know. I can't just say that I'm sure that cervical cancer is caused by this. Yeah. If I'm told he or she may seek treatment, good treatment, but if there is no treatment that this person is going to seek, I don't think if one is able to live for that long. Yeah, because for you to survive, you must seek good treatment. Yeah.
Cervical cancer is a type of cancer which affects women in their reproductive system. Yeah, and it is something hectic. Yeah, it's negligence, because most people don't go for screening, whereas there are free services for that. The other thing is that most people fear the vaccine, because we get the information that it is painful, so you think of going there and you're unable to. Yeah, it may be, because in some hospitals it is offered at a fee, so you get that some people won't go for the screening or something because they have no money to cater for that.
Well, I know it's a chronic illness, and I think that's mostly all I know about it. I don't know much detailed information about it, but I know that people who go through it need a lot of prayers and support. I don't think it's the case. I think cervical cancer also happens a lot in developed countries, like the US. I think I've had a lot of cases in developed countries where they deal with cervical cancers.
Welcome back to Focus on Health, and that is what people had to say on the streets. But right now we have an expert, Dr. Masharia, who is just going to shed a little bit more light on what those people had to say. And he's also going to tell us whether these things are facts or they're fiction. Dr. What's your take on that?
Thank you very much. I keep on saying that, and I always say that poverty is the biggest illness we have in the country.
Wow.
And all over the world. Mm-hmm. It's through poverty then you'll be able to, it causes other illnesses as well. Mm-hmm. In this case of cancer of the cervix, why do I say that poverty is a contributing factor? Mm-hmm. One, I said that cancer of the cervix is 100% curable when it is caught early. Before you get full-blown or cervix of the cancer or of the cervix or symptoms in cervical cancer, it takes about 10 to 15 years. So what does that tell us? It tells us that if it was caught 10 years earlier, then that particular person would have been cured. So poverty comes in that, one, access to health care is a challenge in this country, and especially among the poor. Number two, availability of this screening facility. The screening of cancer of the cervix is very basic. Can be done in any health center. The problem is how accessible are these health centers? So access to healthcare is a problem. Number three, education also, so that people know that this exists and screening can be done. So when there is poverty and people in the slums where they cannot access sometimes good education, these health facilities, then they will not be able to go to the health facilities even, or even know that they exist. Then there will be also high school dropout rates, early marriages. What does early marriages mean? It means early exposure sexual intercourse.
Yeah.
So it becomes a merry-go-round kind of thing.
It's more of a cycle.
It's a cycle. That's
Yeah.
exactly what I'm trying to say.
Yeah.
Yes. So basically, poverty is a big contributor. Then there is the vaccine, which I'll talk about later, maybe when it comes to prevention. Vaccine is not very accessible because I think one jab of the last I checked is between $70 to $100.
Yes, that's around
Yes.
7,000.
That's 7,000.
Which is very high for a common mwananchi who is surviving on $1 per day.
Less than $1 per
Yeah,
day.
less than $1.
Per day.
Yeah.
So 7,000, will this person buy food for the house, pay rent, or go get a job?
That's a very good question, but I think you'll give us a very good perspective as we come to the end of it. But also, when we talk about cervical cancer, we have the stages. So what are the stages of cervical cancer, and at what rate can we say that there is no going back on this?
Absolutely, good question. I will make it very simple so that everybody can understand.
Yeah.
Try to not to be very technical. Cancer of the cervix is divided into 4 stages.
Yeah.
We have the stage 1, which is what we call early cervical cancer or carcinoma in situ.
Yeah.
In this particular case, the cancer is confined to the walls of the cervix. Simple as that. Or wall of the entrance to the womb. Then we have stage 2, and that one, stage 1, is 100% curable.
100% curable.
100% curable. It's amenable to surgery. There are different forms of surgery that just remove the coat of that of the affected cells, and the patient is 100% cured. Then we have stage 2. Stage 2, it is cancer of the cervix. It involves the cells of the cervix, all right, and the upper part of the vagina. This cancer is between 80 and 90% curable through surgery and what we call adjuvant therapy. Adjuvant therapy is like chemotherapy and radiotherapy. You do surgery and then you do chemotherapy, radiotherapy. It's 80 to 90% curable.
Yes.
So as we go down, then we go to stage 3. Stage 3 is where we have cancer involving the walls of the cervix, that is cervical inlet, all right. Then the lower part of the vagina. Now, that one is the survival rate. The survival rate, 5-year survival rate, we put it at 40 to 60%.
40 to 60%.
40 to 60%. The treatment for that stage is basically surgery and chemo and radiotherapy. Okay? So as we go up, as we go down the staging, then it means the poor the prognosis. Prognosis is the survival rate. Then when you go to stage 4 is what we call very advanced disease. This is basically where we say it is more of palliative care, supportive care.
There's nothing, meaning that there's nothing much you can be able to do.
Exactly.
You just take the patient to a palliative care, and that's all you can do.
The disease has broken the borders.
Wow.
It has spread, distant metastasis. It has spread to the lungs, to the bones, to all other body tissue or some other body tissues where there's not much you can do about it.
And it's really sad that coming from stage 1, it's 100%, stage 2, 80 to 90, until stage 4 where we cannot be able to do anything. But we can be able to do something at the start.
Yes, we can.
And the government now is bringing in, is trying to push in vaccination in schools. What's your take on that? And do you think that it's really a step in the right direction to curb cervical cancer?
Definitely, that would be a very big step in the right direction.
Yeah.
Because it means this jab, the vaccination is like lifelong. So if we can get it in the school-going children, the school-going girls, that is, of course, boys don't get cervical cancer, so they don't need the vaccine. But if you can get it in get hold of these school-going girls before they become sexually active, then I think we can be able to eradicate this menace. I think the government is in the right direction, thinking of introducing this vaccine to school-going children.
Yeah. Just a quick question. Are boys not carriers for HPV, in that when we have very many sexual partners, the boys are the ones who are having sex with the ladies? Or there is no way that we can be able to do about that?
Yeah, you see what happens. Well, they can be carriers, all right, but you see now, if they don't get the cancer themselves. But once the partner is vaccinated against it, then it means cannot get infected by the carrier.
Let's talk about prevention, Dr.
Yes, sir.
What is the way out?
Prevention.
Yes.
Prevention is, number one, prevention is screening. No, I will not even say screening. Education. Let the people know.
Empowering.
Empowerment. Let the people know what is cancer of the cervix. Because there are some communities who don't know anything like cancer of the cervix, that it exists. Let people know. Once they know, let them know about the screening. The screening. And let every facility, be it government, be it private, be it government, be this, the smallest dispensary in the village, let them have these facilities to be able to screen for cancer of the cervix. Let there be a program for follow-up, so that when you identify this case, let the government have some machinery to make sure that that particular patient is followed up to the last minute until they get very well, so that they are not lost for follow-up. Because you get that you might screen and say there is a suspicious lesion, then this patient gets lost for follow-up. So you're not able to know where they are and follow up on them. Let it be like the TB program, whereby you can, once you are started on medication, you're enlisted in your nearest health center, you'll be getting medication, you tick on a certain book so that, and make sure that you complete medication.
Yes.
Let's have a program like that one. It is going to really assist in eradicating this menace.
Thank you very much, Dr. Thank you
Welcome.
very much. Yeah. So that's a very good place to end it with here on KUTV. And as you've had, prevention and also broad spectrum of HPV vaccination is the only way that we can be able to make sure that cervical cancer, the preventable cervical cancer, are all taken care of. At the end of the day, the stakeholders are also supposed to come in and bring in legislations that make sure that all these things are passed. Right now, that's all we had for you on Focus on Health. This is KUTV, Focus on Health. I'll leave you with the Did You Know segment.
Five tips for preventing cervical cancer. 1. Go for routine pap tests. Pap tests enable doctors to detect abnormalities, changes on the cells on your cervix, and take action before cervical cancer develops. 2. Follow up on abnormal pap smears. If an infection is present, your doctor will treat you and repeat the pap test at a later time. If the examination or pap test suggests something other than an infection, your doctor will perform other tests to determine the problem. 3. Get vaccinated. 2 vaccines are available to protect against the types of HPV that cause the most cervical cancers as well as anal cancers in men. 4. Practice safe sex. Studies have shown that women who have many sexual partners increase their risk of developing HPV and their risk of cervical cancer. 5. Quit smoking. Smoking cigarettes doubles your risk of developing cervical cancers. Studies have shown that tobacco byproducts damage the DNA of cervix cells and may contribute to development of cervical cancer.